The Minister of Health, Professor Onyebuchi Chukwu, says Nigeria has no cases of Ebola. He was speaking in his weekly briefing to the Federal Executive Council on the deadly Ebola outbreak. According to him, the suspected case from Ife, Osun State, has been declared Ebola-free, while the South African woman, who was also quarantined, had no case of the virus and has returned to her country.
So presently, as we speak, there is nobody suffering from Ebola virus disease in Nigeria, and it has been so for the last 1 week. Within the week, however, there was a suspected case, a student from Obafemi Awolowo University, Ile-Ife, but we've concluded all investigations. She was Ebola negative. She's never had any Ebola virus disease. So Ile-Ife, there's no problem there. There's no incident of Ebola virus disease, and nobody is being placed under surveillance in Osun State. Within the week also, a white South African woman suspected to have Ebola virus disease who was taken into quarantine from the Murtala Mohammed Airport in Ikeja was found after a series of investigations not to be Ebola positive. So she was Ebola negative. She didn't have Lassa fever. She didn't have dengue or any hemorrhagic fever, but just had some gastroenteritis from other causes. So she's long been released from quarantine, and she has left Nigeria.
Meanwhile, the Senate has urged the executive arm of government to strengthen health services in all ports in the country. The federal lawmakers arrived at this resolution after debating a motion on the Ebola virus disease in Nigeria, sponsored by 108 senators. The Senate is urging the African Union and the Economic Community of West African States to create a regional and continental containment program to curb the spread of the disease. They also asked the federal government to immortalize the heroes and heroines, especially Dr. Ameyo Adadevoh, who lost her life in service to humanity.
To strengthen port health services in all ports of entry in the nation, and 5, personnel, and especially the female consultant, Dr. Ameyo Adadevoh, even in death, deserve not only commendation but immortalization for her professional competence and action which restrained Mr. Sawyer, thereby reducing the exposure of more Nigerians to the Ebola virus disease.
I want to say that we need to commend the federal government and the Lagos state government, because the synergy that they were able to establish, irrespective of the party differences, was what saved this situation. If both tiers of government did not cooperate, we would have been in a mess today.
I will want to give thanks to Almighty God for giving us the life of Dr. Mrs. Adadevoh. Our professional ethics are ahead of all other consideration, laying down our life for all of us to live.
Federal government to strengthen port health services in all ports of entry. Those in favor of prayer for, say aye. Against, say nay. The ayes have it.